Hello, everyone. I'd like to thank MENACTRIMS and MSIF for giving me the opportunity to present today the MSIF Off-label work on behalf of the entire team. I'd also like to thank Joanna for providing the slides, and I'd like to acknowledge my clinical co-chair, Professor Bazam Yamut, and our methods chair, Professor Holger. It is indeed an honor to present to all of you the MOLT off-label work. So before I start, allow me to first review the rationale behind the off-label work and the off-label disease-modifying therapies, namely azathioprine and rituximab. So why are off-label therapies important, and why do we have this project? Off-label DMTs refer to a group of drugs that do not have regulatory approval specifically for MS, but they do have regulatory approval and are used to treat other conditions, including autoimmune diseases. The data available for its treatment with MS is variable and limited. They are called off-label drugs as they don't have the indication for MS specifically on their label. On-label disease-modifying therapies, on the other hand, are drugs that have regulatory approval for MS in their label. Now, we look at this recent study from the Atlas of MS. We find that about 30 to 70% of countries globally, from low and lower middle income countries, do not have on-label DMTs available for patients with MS. Furthermore, if we look at these two charts over here, looking at an analysis done on the essential medicine list for 137 countries, we find that only a third have on-label disease-modifying therapies such as interferon or fingolimod in their essential medicine list. Furthermore, we find more than 95% of countries have off-label DMTs readily available in their essential medicine list. Now, most countries follow the essential medicine list as subscribed by the WHO. So this brings home to us the fact that it appears that off-label disease-modifying therapies are more available in many countries and healthcare systems globally. Now we look at this particular chart published from the Atlas of MS, looking at on-label and off-label DMTs available globally. We find that the yellow bars, which represent off-label DMTs, and the blue bars that represent on-label DMTs. Amongst the off-label DMTs, rituximab and azathioprine are the commonest off-label DMTs used in nearly 68 to 70 countries, respectively. Therefore, off-label DMT use is quite common in just under 70% of countries. So with this realization, this brings home to us the value and the role of the MOLT panel in looking at the off-label disease-modifying therapies currently available. So this work by the off-label panel is mainly to look at data whether off-label DMTs are as effective and safe to use in the treatment of MS. And in order to look at this, the panel was created to review the evidence and to come up with recommendations. So to place things in context, this work by the MOLT panel would target areas where the availability and affordability is stopping people with MS from accessing a range of disease-modifying therapies. To achieve this, it would be important to create a robust and transparent process to review off-label DMTs. Secondly, to review the two most commonly used off-label DMTs, namely azathioprine as well as rituximab. Now, in order to achieve this, the MOLT panel firstly created general principles to guide the ethical use of off-label disease-modifying therapies. These principles are endorsed by a number of neurological organizations as well as regional TRIMS, including MENACTRIMS. These off-label general principles have been published earlier this year in the Multiple Sclerosis journal. So what are these general principles? Firstly, that off-label use of DMTs to treat MS should be driven by the need to protect a person's health. Secondly, off-label use should be evidence-based and considered when on-label disease-modifying therapies are not tolerated, unsuitable for best clinical outcome, unavailable, or unaffordable. Thirdly, shared decision-making between people with MS and their healthcare professional is especially important when off-label DMTs are considered. Fourthly, appropriate information on health benefits and risks of off-label DMTs should be made available to people with MS by their healthcare professional during the full disease management pathway. And lastly, outcomes, effectiveness, and adverse events when using off-label DMTs to treat MS should be carefully monitored. The MOLT panel also acknowledged that the guideline would be useful for long-term changes. And the long-term changes where the guidelines would be helpful in supporting and facilitating would be, firstly, to support evidence-driven clinical decision-making and reimbursement decisions for the use of off-label DMTs to treat MS as needed. Secondly, with regard to the regulation of off-label prescribing for MS, both nationally and internationally, to support best clinical practice. And lastly, to help healthcare systems and payers to consider reimbursement policies for off-label treatment in low-resource settings mainly. So in order to achieve this process, the MOLT panel used a structured process that was established for the development of the guideline with emphasis on transparency and clarity. These processes have already been published earlier this year in the Multiple Sclerosis Journal, an experimental and translational clinical journal, and it outlines the processes used in great detail. With regard to the evidence review, mainly systematic reviews of data were accessed, and the GRADE evidence decision framework, as you can see here, were used to make the recommendations. The panel also set up collaborations with the Cochrane Group for Evidence Review and Synthesis, and as well as the GRADE McMaster University Group, who are experts in guideline methodology to facilitate in the evidence to decision framework and to come up with the final recommendations. So if you look at the development process, the MOLT panel is at the center of the guideline and recommendations, but different global and regional stakeholders make up both Tier 1 stakeholders as well as Tier 2 stakeholders. And these stakeholders were consulted at every level of the process for their opinion with regard to the development process. Now, coming to the recommendations. As I mentioned, the MOLT panel looked at the two commonest off-label therapies, mainly azathioprine and rituximab, both in relapsing as well as active progressive MS. The recommendations with regard to these drugs will be open for public comment soon, but I can share some of the areas that the recommendations will cover. The use of azathioprine was looked at in relapsing MS mainly as either first choice treatment or as compared to other DMTs. However, there was not enough evidence or data with regard to the use of azathioprine with regard to progressive MS and when switching from another DMT in relapsing MS. With regard to rituximab, there was a little bit more data for rituximab, and there was enough data to consider its use in both relapsing as well as progressive active MS as first choice treatment when switching, as well as when compared to other disease-modifying therapies. There was also evidence for rituximab in active progressive MS. However, there was not enough data with regard to rituximab compared to other DMTs in progressive forms of MS as first choice treatment. So where are we in the process currently? We are currently at the stage of the draft recommendations, as you can see over here, over the left side of the diagram. And we are currently, from this stage of draft recommendations, we will be making the final recommendations in consultation with key stakeholders, and this will be open for public comment soon. Now, following this, the guideline will be published, and after that, it will be disseminated and hopefully used in advocacy activity. So next, Najwa Akbari and I are going to share case studies from Morocco and Malaysia to show how these off-label recommendations can be used to improve access to treatment. With that, I thank you for your attention and we'll move over to the next talk. Thank you very much.